Welcome back to Houston Life. Now, it's shocking that about 10% of 12-year-olds say they have tried alcohol, but by age 15, that number jumps to 50%.
Research shows the sooner you talk to your children about alcohol, the greater chance you have of influencing their decision about drinking.
Yeah, Harris County Public Health wants to help you start that conversation. And Executive Director Dr. Umair Shah stopped by Houston Life to talk about their campaign to prevent underage drinking. Take a look.
These are the alarming numbers, and these are the scary things that we really need to make sure that our parents know, is that don't wait till you think that you're seeing signs. You need to have these conversations now, before your kids are even at a point of thinking about starting these kinds of substances, whether it's alcohol, whether it's other kinds of drugs or illicit substances. We want to make sure that those conversations are happening today. Don't wait till tomorrow. Don't wait till next week. Don't say, I'll just wait another year. Let me wait till my kid gets to this grade or that grade. These conversations need to happen as quickly as possible.
Is it just starting with, say, sneaking a beer, or are they going for the hard liquor?
It's both. It depends whatever you have access to. And sometimes you may not even have access to it, and you'll somehow get access to it. You'll make access to it. You'll break into something to get that drink. Or the easy road is the fastest road, which is one of your friends says, here's a beer. Here it is. No, go ahead and try it. And you're going to feel left out. And so that's why a lot of times we're seeing peer pressure being such a huge factor in this.
Now, Harris County Public Health, you guys have a collaboration with SAMHSA, which is the Substance Abuse and Mental Health Services Administration.
Right.
So tell us about this collaboration. And also, you mentioned starting the conversation. How do parents even start their conversation with their kids?
So really, it's an underage drinking campaign that we have, and SAMHSA is the federal agency that really has put out a number of different resources, toolkits, and information for health departments like us, but also to community members. So kids will know, parents will know, community members will know are the kinds of things that they can do to do what you just said, to start that conversation. So we've got toolkits that are available that you can get access to. And so what our campaign is really about is to raise awareness in the community. It's not just raising awareness amongst us. I can talk all I want to the health department, but we need to talk to our community. It has to be a two-way conversation. We want to make sure that our parents know, our community members know, and especially our kids know these are the kinds of things that they need to be aware of. And that's what this campaign's all about. Federal partners here at the local level, that we can work together so we can get the information out.
What is your advice to parents out there who do drink, take that occasional drink? And, kids nowadays, they want to follow what mom and dad do. What is your advice to those parents trying to talk to their children about alcohol?
I think that's the first thing. Talk to your child about alcohol. That's the most important thing. So even if you're having a drink, talk to your child about responsible use of alcohol. Talk to your child about the right age to use alcohol. Talk to your child about the kinds of things that they may be getting from their peers about alcohol or other substances. Talk to them. Don't just wait for another day when there's no conversation and say, a week from now, a month from now, or never will I get to this. Don't put this in the too hard to do box. Put this in a box that you've got to be able to do today.
All right, and we do have our panel with us today. We brought in some young adults from the Palmer Drug Abuse Program to share their experiences. Devin, Isaac, Paul, and Sarah, thanks to you all for joining us. So it sounds like alcohol was a common theme for each of you that then led to using other drugs. So Sarah, tell us, once you had started drinking alcohol, what did that lead to for you?
Once I started with alcohol, I had friends that just it opened up this oh, so you drink, so you're okay with other drugs, and so just being exposed to different drugs, whether it was prescription pills, weed, harder drugs, party drugs ecstasy, and it just opened up this gateway that since you do this, you're gonna be you're okay being exposed to other stuff. So I mean, it was whether it was at school or on the weekends or at home, it kind of was pretty rapid.
For any of you, do you remember a point in your teenage life when someone talked to you about drugs and alcohol? A parent, a teacher, some sort of mentor?
Not even in school. Wow.
No?
Wow.
I saw DARE in 5th grade.
DARE, the drug abuse
resistance
education.
I didn't pay attention though.
Wow.
So Devin, when you started drinking at age 12, how quickly from that point did it escalate to the prescription drugs, to other, to the point of where you had a serious, serious problem?
You know, it actually didn't progress too rapidly due to the fact that I was in sports and stuff like that. But as soon as my time got taken away from that, when I was in high school, especially just getting into high school period, it escalated pretty quickly.
Dr. Shaw, I mean, based on what our lovely young people here are saying, you're probably not surprised because this is exactly what you were talking about. Parents starting the conversation with young people. I think that's a strong takeaway from this conversation.
Absolutely. And the other thing is your question about parents and also other community members. So you've got folks that sometimes kids may not listen to parents, but there are other mentors or other folks that they look up to, and whether it's a community member who's a teacher or somebody that a firefighter or what have you. But we need to all as a community think about this as a community-wide problem, and we need to come up with community-wide solutions. So it's all of our responsibility to have those conversations early on with kids.
So Isaac, you started drinking at a young age and then went on to drugs and additional things. What was it that pulled you back, that helped you to get help?
Fellowship, finding friends that actually cared about me, you know, not just people looking for money or drugs or somebody to help them out to get drugs or something like that. It was just the community, the family, the honesty, and just the true happiness.
Surrounding yourself with good folks.
Right.
Now, guys, you're all part of the Palmer drug abuse program. So tell us a little bit about the program.
It's really like the coolest place like ever. Ever since like I got in 2012, and it's just amazing. I mean, like, and it's not at all what you would think. You know, like the way I thought it was gonna be is like you were gonna go there and they were gonna tell you like bad, like don't do drugs, like don't do this, and you know, make you talk to therapists and things like that. And it's not like that at all. It's basically just I loved it there because there was a bunch of other people that were just like me. You know what I'm saying? That were the same age, same interests, and they all liked to get high, but they weren't getting high anymore. You know what I'm saying?
It sounds like you can think of peer pressure in such a negative term that you guys have all gone through, but it also sounds like positive peer pressure can have a significant impact.
Yes.
Definitely.
Yeah.
And also, we should point out, too, that the Palmer Drug Abuse Program is a cost-free program that families can take advantage of. This is one of several resources in the community, right, Dr. Shaw?
So a lot of resources that we have it on our website. We're really getting information on social media and really a lot of campaign information, whether it's in movie theaters or billboards. And really our goal is to reach a lot of folks. So not everybody's heard of the health department, right? No, how many of you have heard of the health department before this?
I knew it existed.
Ah, there you go. You knew it existed. All right, that was it.
I never
And
really
so,
seen it.
right, he had never seen it. It was the first time he had met me, the first time I had met him. And so what we really want to do is to get this information into the hands of people who need this information, who really can benefit from this information. And that's why this campaign is important. That's why we have these resources. And that's why we're spending a lot of time putting this on our website, but also making this information available to the people that it really impacts.
And you guys also have health screenings as well.
That's right, absolutely. So we're in the community. We believe health happens. So I'm a doc who, you know, all these years of clinical stuff, and I used to think health happened only in the controlled environment of an emergency department, a hospital, or a clinic. But we have started to really have this conversation that health happens where you live, learn, work, worship, and play. It happens in the community. And that's where our community is. That's where our members of our community are. That's where we need to be in order to impact health. So it's not the brick and mortar, just clinics and hospitals. It's also getting into the community. So we have a lot of mobile screenings and doing a lot of things so we can get to kids, get to people, and be able to provide information.
You always hear it takes a village to raise a child. It truly, truly does. Dr. Shaw, thank you. And to Devin, Isaac, Paul, and Sarah, thank you for sharing your stories. Thank you to Harris County Public Health for starting this conversation in the community.
And if you'd like more information on drugs, substance abuse, or treatment centers, you can call SAMHSA's help hotline at 800-662-HELP or visit them online at samhsa.gov. More Houston Life right after this.